Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. What's going on? Dr. Chris here. Today I want to talk about vertigo. I've talked about this on podcasts in the past, but I've seen a fair amount recently, and I want to talk about some of the causes. Now, I will say there are lots of different types of vertigo. I want to be specific today to BPPV, which is benign paroxysmal positional vertigo, or the crystals in the ear issue. So this can be extremely debilitating, extremely scary for people. So this is the hallmark of this is you lay down and you turn your head to one side, or maybe you sip on some water, some sort of positional change of your head, and suddenly the room is spinning like you're drunk. It can make you throw up. It can be terrifying. People usually rush off to the ER thinking the worst is happening. But it's actually really an easy fix. I'm not going to really get into that. I'm going to get into what's the underlying issue here. So you may have heard that we don't really understand it, and that's true. We don't fully understand it, but there's definitely some signals in the evidence and some clues, and like many things, it looks like a lot of this stuff can be related to diet. It certainly can be from trauma. It could be from pressure changes. So let me explain first exactly what's going on. So you have these semicircular canals in your inner ear. So this is different from your outer ear. Something that's affecting your outer ear shouldn't have really any kind of effect on the inner ear. Now, when you look at the inner ear, you got these canals, as I mentioned, and 3 per side, and they have this common area. There's something called a utricle that has these hair cells on top of them, and then these crystals that kind of are embedded within these hair cells. Now, when you turn your head to one side, the fluid in the canals pushes those hair cells in one direction on one side and the opposite direction on the other side, and that's how your brain knows where you are in space. There also is 2 layers to these semicircular canals. There's an endolymph and a perilymph. One's got more sodium in it, one's got more potassium, which creates a gradient. I'm just explaining all this because it kind of is relevant to what I'm going to be talking about in a second. So first I'll get some mechanical reasons out of the way. I mentioned blunt force trauma, so a lot of times we'll hear someone hits their head on the freezer. In other words, they open the freezer, then they bend down, they open the fridge, they forget the freezer's open, and they hit their head on that. That's what I hear pretty often. It could also just be from a fall or a hit to the head, like in a sporting event or something like that. It can be preceded by pressure changes, so if you've just gone scuba diving or you just flew recently, that can be enough to trigger it. But more often than not, I suspect, it has more to do with diet, because I ask a lot of people questions about diet. I ask about their glucose, their A1C, I ask all these kinds of questions. And I can't tell you how many times it's like, well, I went to a birthday party, had 2 large pieces of cake and a soda, and then the next day, boom, it gets triggered. So insulin resistance, once again, seems to be part of this picture. Right? Insulin resistance can cause gout. We know there's association between gout and BPPV. But let's get into some of maybe the pathomechanics. So one thing insulin resistance does is cause microvascular dysfunction. So it damages the blood vessels. That tends to happen mostly at the periphery first, because that's where the vasculature is the smallest. So the smallest vessels get affected first. And one of these areas is the inner ear. So if you have damage to the inner ear from blood supply damage, is it going to affect your balance and vertigo? Absolutely. The other thing that insulin resistance causes is inflammation. It's basically chronic low-grade inflammation, and that can affect various parts of the body, including the inner ear, which can definitely disrupt the vestibular system. And then, of course, that whole system has a nerve attached to it, the vestibular cochlear nerve. And we know that insulin resistance can damage nerves. Then there's also sort of secondary things that can affect the vertigo system, the vestibular system, such as the medications that are prescribed for things like diabetes, such as antihypertensives and diuretics, they can all have effect on that vestibular mechanism. And finally, metabolic imbalance can cause all kinds of disturbances, particularly in this case that's relevant, electrolyte disturbances. I mentioned there's a sodium-potassium gradient. So if your electrolytes are off, then you can definitely have a vertigo event. I suspect that's a big reason too, especially in Florida. We all sweat in the heat here. Everyone replaces waters, and they forget to add the electrolytes back in, and there's sort of this prevailing fear of salt for some reason that just needs to die. Salt is not the demon. It only is an issue if you've already got insulin resistance. Anyway, replacing the salt and the potassium at normal levels can definitely affect that pressure gradient. I should also mention that part of what causes BPPV is degeneration of the otoconia. Otoconia are those crystals. So what causes that? Well, that's been linked in a study in 2016 to vitamin D deficiency. And what causes vitamin D deficiency? Lack of adequate sun exposure. So once again, the advice we're getting, stay away from salt, stay away from the sun, is having repercussions on us. So here is another study I found. This was in 2015, conducted in Brazil by Webster and Company. They followed a group of 72 patients that had BPPV, and they followed them for 4 years. And what they found was that the recurrence of BPPV with patients that had hyperinsulinemia, so too much insulin, to be 4.6 times greater than those without. And then also they found that the recurrence of patients with hyperglycemia, so high blood sugar, to be about 2.47 times greater than the general population. Another study in 2008 found that hyperinsulinemia has been associated with endolymphic high drops, which is a different form of vertigo. And there's been several studies that have associated endolymphic high drops as a potential cause of BPPV. So in this case, maybe hyperinsulinemia is the underlying issue. All right, lastly, pH levels can have an effect on these crystals. So if you are high in acid or in acidosis, that can erode these crystals. What is one thing that can affect your pH? There's some dietary stuff that maybe has a small influence, but breathing is super important. You can greatly affect your pH by the way you breathe. If you're mouth breathing, it's going to tend to lead to increased acid in the bloodstream. So these things all go together. What does chronic stress cause? It causes chronic cortisol release, and therefore sugar release, and therefore diabetes and weight gain and sleep apnea. And guess what happens? BPV, it tends to happen most often in the morning. So if you've got apnea and you're mouth breathing all night, right, there's a pattern right there. So to pull us all together, once again, it's all about our lifestyle choices. It's our diet. It's our stress. It's how we choose to live our day-to-day. And I talked about this in the Canary and Coal Mine episode. It's just you apply enough stress to the system, and then your weakest link shows up. And how it expresses itself is what we name the thing, right? In this case, it's BPPV. Okay, so what do you do? So the good news is it's super easy to treat. You don't need medicine. You don't need surgery. You find a physical therapist that's trained in vertigo. There's a maneuver we do, which is move your head around in a certain way. First, you have to test which canal it is. And once we figure that out, we can easily move those crystals where they belong, where they get reabsorbed. And usually one treatment, maybe two, is all it really takes. By the way, don't Google these exercises and try them on your own, because there's 3 canals on both sides of your ear, so you have to first figure out which canal it's in. If there is a common location where these canals meet, so if you don't pick the right one, you might get lucky, but if you pick the wrong one, maneuver, you can dump those crystals into a second canal, and then you have 2 problems. So there's a somersault maneuver, there's a Brandt-Daroff exercises. I usually do not recommend those. So just know it's easy, an easy fix. Go see someone 1 or 2 times and recognize that there is, maybe there is a mechanical reason. Maybe you had to fall. Fine. But maybe not. Maybe there's a dietary component to this, and be thankful that you got away with such an easy fix, and that's your warning indicator that there's something else going on deeper. So this is where you have to get your blood work and find out what's happening. So if you're experiencing any of this, reach out to us. We do treat vertigo. We do know how to read blood work. We can put this all together for you and give you some answers. Please feel free to call or email Chris at dynamicnaples.com. Thanks. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with a goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.